Okay, let's unpack this. We're diving deep today into a listener's revision notes, specifically focused on renal transplant.
Yeah, good topic.
Our mission to take these concise, packed notes and, pull out the absolute core information, making it really high yield for anyone needing to understand this quickly, or just solidifying their revision.
Exactly.
We're not adding anything new, just bringing the crucial points from these notes to life.
And it's such a fundamentally important area in medicine, isn't it? Renal transplant, I mean, it offers a lifeline for patients with end-stage kidney failure.
A real game changer.
Totally. It
Yeah.
lets them regain function, significantly improve their quality of life. So understanding the key aspects from why it's needed to how it's managed long-term is pretty essential.
Absolutely. So think of this as your guided tour through the essentials of renal transplant. Just based on these notes, we'll cover, well, everything. The basics, why it's needed, how it works, what can go wrong.
The monitoring, management,
Yeah.
the outlook, potential challenges. Yeah,
Mm.
let's jump right in, starting with the absolute fundamental question these notes address. What is a renal transplant?
Okay. So, at its heart, as defined in these notes, it's a surgical procedure. Simple as that.
Right.
It involves taking a healthy kidney, and this can come from either a living donor or someone who is deceased and surgically placing it into a recipient.
And who is this recipient? The notes are specific here.
Yeah, the recipient is a patient diagnosed with end-stage renal disease, ESRD, or, someone who has very severe irreversible kidney dysfunction.
Right, so their own kidneys are essentially failing. And the core purpose, the main goal of this procedure, as the notes frame it?
Well, it's to restore kidney function, basically replacing the non-functional native kidneys with a healthy one that can do that vital job of filtering waste products and excess fluids from the blood.
The ultimate renal replacement therapy for many, really.
That's a good way to put it, yeah. So that's the what. Now, for the why, the notes list the etiology, the underlying reasons someone might get to ESRD and need a transplant. What are the most common causes we'd see?
Primarily, like the notes say, it's the end result of chronic kidney disease or some kind of irreversible damage.
Okay.
And the specific conditions leading to this are really important to know for revision, definitely. They're the ones you'll commonly encounter. The notes list chronic kidney disease itself as a kind of broad category.
Mm-hmm.
But then they get specific. Diabetes, hypertension, glomerulonephritis, polycystic kidney disease, and, various other renal disorders. Those are your major culprits.
So those conditions damage the kidneys over time until they just, can't function anymore.
Pretty much, yeah.
So needing a transplant means you have ESRD from one of these causes. But the notes also touch on what makes someone a candidate for the procedure itself, the risk factors for actually undergoing the transplant. What are those things?
Well, the notes make it clear that the primary risk factor for needing the transplant is having ESRD, or that irreversible kidney damage in the first place. You wouldn't even be considered without that.
Obvious, but important.
Right. But eligibility for the surgery itself involves other factors. The notes list meeting specific medical and psychosocial criteria. Basically, you need to be generally healthy enough for major surgery and, crucially, capable of sticking to the complex post-transplant plan.
And you need...
Yes, you need a kidney. The availability of a suitable donor organ, whether it's living or deceased, that's obviously critical.
Can't do it without one.
And finally, the notes mention the absence of contraindications for the surgery itself, meaning there shouldn't be other medical issues that make the operation too dangerous. It's a multifaceted assessment.
It's definitely more than just having bad kidneys, then. Okay, we know what it is and why. Let's get into the mechanics. How does the surgery actually work? The pathophysiology section in the notes.
Yeah, it's interesting how revision notes tackle this, focusing on the key outcome. The main surgical step is placing the healthy kidney. Now, unlike the original kidneys way up near the back,
Yeah.
the transplanted kidney is typically placed lower down in the recipient's pelvis or lower abdomen.
In the pelvis. That's a key anatomical detail to remember. Why there, though? Is it easier access?
The notes don't spell out the surgical reasoning, but yeah, that location provides easier access to the major blood vessels down there,
Yeah.
and there's just more space.
Okay.
The notes then describe connecting the blood vessels of this new kidney to the recipient's blood vessels right there in the pelvis. That gets the blood flowing.
Right.
And the ureter, that's the tube carrying urine, is connected to the recipient's bladder.
So the new kidney gets its blood supply, filters the blood, and the waste just drains into the existing bladder.
Exactly. And the result, as the notes succinctly put it, is that the transplanted kidney starts filtering waste and excess fluids, effectively restoring kidney function.
It's quite an elegant solution, really. bringing a new organ online using the existing plumbing.
Yeah, that's one way to look at it.
Yeah, let's talk about when things don't go perfectly. If a transplant recipient is having problems, what are the main things doctors need to think about? The notes list a differential diagnosis.
Right, this is super high yield for understanding post-transplant care. If the new kidney isn't working as expected, or the patient just feels unwell, what's on the checklist?
Yeah, what are the big categories?
The notes give you the primary categories you need to rule out, basically. First up, rejection episodes.
The body fighting the new kidney?
Precisely, where the recipient's immune system tries to attack it. This can be acute, happening pretty soon after, or chronic, developing over a longer time.
Okay, what else?
Infections affecting the transplanted kidney. That's another major consideration, especially given the medications they're on.
Right, the immunosuppressants. Makes sense. Anything else major?
Recurrence of the underlying kidney disease is listed. Sometimes the original problem that wrecked the native kidneys can actually start to affect the new one.
Oh, wow. That's tough.
It can be. And then the notes include a sort of general category of other complications associated with the transplanted kidney. Bit of a catch-all.
So if you're thinking about post-transplant issues, the big worries are rejection, infection, the original disease coming back, or other sort of general problems with the kidney or the surgery itself. Those are the crucial boxes to check first.
That's the core list from these notes, yeah.
Let's zoom out for a moment and look at the bigger picture, the epidemiology. How common is this procedure? The notes mention the UK context specifically.
Yeah, the notes state that many patients in the UK are waiting for kidney transplants. That tells you straight away there's a significant burden of ESRD and a high demand for this treatment within that system.
But the notes include a really important reminder here, especially if you're revising.
Oh, absolutely. They explicitly say that precise statistics vary and that you should always refer to updated sources. Waiting list numbers, transplant rates, they change.
Good point.
So while the fact that many are waiting is key, getting the exact current number requires checking the latest data. It's a good lesson. Actually, notes give you concepts, but live data needs recent sources.
Great point. Okay, shifting gears to the positive side. The clinical picture, what does a successful transplant actually look like for the patient? What improvements would you expect to see?
This is the goal, isn't it? The notes list the tangible benefits. The most direct one is improved kidney function, obviously, which we measure with tests we'll get to.
And that leads to?
Well, that directly leads to a reduction in those debilitating symptoms of ESRD.
Like the fatigue, swelling, nausea, all that stuff.
Exactly. The notes also list normalization of blood pressure, which is often really hard to control in kidney failure. Increased urine output is another good sign that the new kidney is filtering properly. And perhaps most significantly, from the patient's perspective, the notes state there's an enhanced overall quality of life.
That really highlights the impact, doesn't it? It's not just about lab values. It's about giving someone their energy and, well, their life back.
Absolutely. It's transformative.
Okay. The kidney is in, hopefully working well. How do doctors keep a close eye on it? What investigations are used to monitor the transplant?
The notes detail the standard tools here. First, and probably most frequent, are blood tests.
Right.
These are absolutely vital for assessing kidney function over time, looking at things like creatinine and urea levels. Gives a pretty quick snapshot of how well the new kidney's filtering.
Quick, easy, essential. What about pictures, imaging?
Yep. Imaging studies are mentioned, ultrasound or maybe CT scans. These are used to look at the structure of the transplanted kidney, check the blood flow, and spot any anatomical issues or like fluid collections.
And if there's a real worry, say they suspect rejection.
That's when the notes mention a renal biopsy might come into play. Now, this is more invasive, taking a tiny tissue sample, but it lets doctors examine the kidney tissue under a microscope and get a definitive diagnosis. It's especially key for rejection or figuring out specific types of injury. It's kind of the diagnostic gold standard for a lot of complications.
So bloods for the function trend, imaging for structure, and biopsy for the detailed diagnosis when needed. Got it. That covers monitoring. Now, the long-term care of a transplant patient, specifically in the UK context, these notes focus on. What does that involve?
Okay, management. The notes emphasize a multidisciplinary approach. That means a whole team, doctors, nurses, pharmacists, dietitians, maybe others, all working together.
Makes sense.
Key aspects listed are close monitoring of kidney function, which ties right back into those investigations we just talked about.
And the crucial part we mentioned earlier, the one that prevents rejection.
Yes, the administration of immunosuppressive medications. These are completely non-negotiable. They're absolutely critical for stopping the recipient's immune system from attacking and destroying the new kidney.
And that's forever.
This is a lifelong requirement, yeah.
Wow, lifelong medication to keep the new kidney safe? That's a huge commitment for the patient.
It really is. The notes also mention regular follow-up visits, essential for monitoring, adjusting meds, catching any issues early. Lifestyle modifications are included too.
Like what?
Well, patients might need to adjust their diet, exercise, manage other health conditions like diabetes or high blood pressure, and definitely avoid smoking to protect their overall health and the kidney.
Right. And the notes really hammer home one point under management. They actually mention it again.
They do, which tells you just how important it is. Medication adherence. Sticking strictly to the prescribed immunosuppressive plan is crucial. Absolutely crucial for preventing rejection and keeping that transplanted kidney working long-term.
It's often the single biggest factor influencing success, isn't it?
You could definitely argue that, yeah. It's right up there.
That double mention really emphasizes its high-yield importance for revision. And finally, regular laboratory tests are listed again under management, just reinforcing that ongoing need to check function and spot problems early.
Consistent monitoring is key.
Looking ahead now, what influences the long-term outlook? The prognosis for a transplant recipient.
Okay, prognosis. The notes list several key factors here. The overall health of the recipient is important. Their general condition, any other medical issues they have, those play a big role in recovery and long-term well-being.
Makes sense.
Donor kidney compatibility is also listed. Generally, a better match means a lower risk of rejection, which is good for the long run.
And complications, I assume, play a part.
Oh, definitely. The presence and severity of complications, particularly those rejection episodes and infections we talked about, they significantly impact the prognosis. Catching and managing them effectively is vital.
And guess what's listed again under prognosis?
Let me guess. Medication adherence.
Bingo. Described as crucial for long-term graft survival. Consistency is absolutely key.
It just keeps coming back to that, doesn't it?
It really does. So if these factors are favorable, if things go well.
The notes state that successful renal transplants have the potential to significantly improve both quality of life and long-term survival compared to staying on dialysis. It's genuinely life-extending and life-enhancing.
That's the hopeful picture, the goal. But to be comprehensive, the notes also list the potential complications. We need to cover those. What are the specific problems that can arise?
Right, the flip side of prognosis and management. The notes list rejection episodes, again, both acute and chronic, as a primary concern. You're always watching for that.
Always.
Infections are another major complication. Often that's a direct result of the necessary immunosuppressive medications, sort of weakening the immune system's defenses against bacteria, viruses, fungi.
So the drugs that stop rejection also make you vulnerable to infection. It's a constant balancing act.
It's exactly that. And the notes also list medication side effects themselves as a complication. These drugs are powerful. They can have systemic effects beyond just immunosuppression, things like high blood pressure, diabetes risk, even cancers long-term.
Right. What else?
Surgical complications related to the operation itself are possible, just like with any major procedure: bleeding, clots, wound issues. The recurrence of the underlying disease, we mentioned that before. It's listed again here as a potential problem affecting the transplanted kidney.
Yeah.
And finally, just general long-term issues with the transplanted kidney can develop over time, even without obvious rejection or infection. Gradual decline in function, sometimes.
That list of complications really underscores why all that ongoing monitoring and management is just so crucial.
It absolutely does. And the notes wrap up this section by explicitly stating that regular monitoring and proper management are aimed fair and square at minimizing these complications and enhancing graft survival. The whole point of that comprehensive care plan is to keep the kidney healthy and working for as long as possible.
Wow, okay. We've really taken these notes and walked through the entire journey from, why someone needs a transplant, through the procedure itself, what can go wrong, how patients are monitored and managed.
The factors influencing success, the specific challenges.
Yeah, all of it. It provides a really clear, structured framework for understanding this pretty complex topic straight from the revision notes themselves.
And having this kind of structured understanding is incredibly valuable for revision, isn't it? It helps you see how all the different pieces connect.
How so?
Well, how the need for the transplant links back to the underlying disease, how the surgery impacts the body, how the management strategies are specifically designed to combat those potential complications we listed, and how all these factors influence the long-term outcome. It all fits together.
Right. So let's just pause and think about the big picture for a second. We've seen that list of potential complications, especially the risk of rejection and infection. And we've heard about the absolute necessity for lifelong immunosuppressive medications and that strict adherence, which the notes kept emphasizing.
What does this complex picture, the ongoing challenges, the required vigilance, what does it tell us about the reality of living with a transplanted kidney, beyond just the amazing life-changing surgery itself?
That's a great question. I think it tells us that the transplant isn't really a cure for kidney disease in the traditional sense. It's more like a shift to a new, complex, chronic condition that requires constant, active management by both the patient and their whole medical team.
So the surgery is just the beginning.
Exactly. It's the start of a lifelong commitment to care, to vigilance, to managing that balance we talked about.
That's a really powerful takeaway. It puts the management and complications sections into perspective. They're not just bullet points on a revision list. They represent the daily reality for these patients.
Yeah, that's right.
Well, that brings our deep dive into these renal transplant revision notes to a close. We really hope unpacking these points has made them more memorable and useful for your revision. Definitely. Framing these core concepts and seeing how they fit together is so key to making high-yield information stick in your brain.
It really is. And if you're looking for even more high-yield revision material just like this, be sure to check out passthemsra.com.
And don't forget, you can also find a ton of great free resources over at freemsra.com.
Thanks so much for joining us for this deep dive.